Hi guys, it's me, Hannah. You know me, I'm a senior here. Well, hopefully you know me, if not, hello. I'm a senior here at UD, and this is my presentation on malaria. So I just kind of wanted to give you a little bit of an introduction on why I chose malaria and why I'm interested in it. So I've had a recent passion for Jane Goodall. I think she's absolutely amazing. And I've been reading her book, In the Shadow of Man. And in her book, she goes over, well, it's about her expeditures in Gombe in her research with chimpanzees, and she actually gets malaria. And she talks about it on the first page of chapter 3. She says, after about 3 months after our arrival, Van and I felt ill at the same time. It was undoubtedly some sort of malaria, but since we had been told by no lesser person than the doctor in Kigoma that there was no malaria in the area, we had no drugs with us. How he came to believe such a strange fallacy, I cannot imagine. We were too naive to question him at the time. And she goes over different symptoms that she had, including sweating, fever, no strength, very weak, temperatures. One of the girls had a temperature of 105 degrees almost constantly for 5 days. So that was just like very intriguing to me, and that's why I wanted to do the presentation on malaria. Also, I hope that if one day I am able to go to Africa, that I will be as prepared as possible if I were to get the disease, how to treat it, and also how to prevent it. So let me move myself here. The taxonomy for malaria, the kingdom is Protista, the subkingdom is Protozoa, the phylum is Apicomplexa, the class is Sporozoacida, the order is Eucocydioida. I'm so sorry I butchered that. The family is Plasmodidae. The genus is Plasmodium, and there's 5 species that are able to cause malaria in humans and animals. We'll talk about that later. But they are Falciparum, Vivax, Malariae, Oval, and Knowlesi. So the first 4 are species that are typically infect humans. And the last one, Knowlesi, according to the World Health Organization, typically infects animals. So P. falciparum is the most life-threatening species of the 5. It's known to cause failures in the liver and the kidneys, convulsions or coma. And P. ovale and P. vivax, those are less critical. They're able to lie dormant in the liver for months or years. So they could potentially recur. Your symptoms could potentially recur for that long. So the incubation periods vary by species. So P. falciparum, the incubation period typically lasts 7 to 14 days. P. malariae typically lasts 7 to 30 days, so quite a range there. P. vivax and P. ovale, their incubation period is 8 to 14 days. And that is like the time between an infectious mosquito bite and when it would show up in a blood smear. Put myself up here. So there are lots of different modes of transmission for malaria. The typical one that's most common is just mosquito-borne malaria. So malaria has to come, the only vector for malaria is mosquitoes, but we'll get into that. It gets a little bit more complicated. So the natural transmission of malaria, it's a cyclical infection between humans and mosquitoes. So the mosquito gets the infection from a blood meal consumed from its host. and then small amounts of that blood containing malaria, they get taken into the mosquito after it bites it, and it mixes with its saliva, and it's transmitted to the next individual that it bites after it's done feeding. That's the typical method. There's also various modes. As you can see, there's airport malaria. That's when an aircraft goes from a malaria endemic country to a non-endemic country and carries infected mosquitoes inside the aircraft. So that's one way that people in a non-endemic country can get malaria, can get mosquito-borne malaria without having had traveled abroad. The next one is congenital malaria. So congenital malaria, it happens when a mother passes the parasite onto her child during pregnancy or delivery. So if an infant is sick, the doctor should ask for travel, transfusion history of the parents and also close relatives, and they should obtain blood films to rule out malaria, or figure out that the baby does have malaria, because although malaria can be fatal, it's also easily treatable if you know that that's what's going on. Another rare sort of form of transmission is transfusion transmitted malaria. So that occurs because the US, there's no real screening method for malaria in our donated blood. So sometimes, it's very rare, but sometimes someone will be infected with malaria, give blood, and then it'll be in the donated blood. And whoever receives that donated blood could get malaria from the infected parasites within the blood. So it's very rare. Along those same lines, it can happen with organ donation. It can happen with needles through drug users, but for the most part, malaria is transmitted from mosquitoes directly. So there's lots of symptoms of malaria, and they vary based on if you have uncomplicated malaria or severe malaria. So uncomplicated malaria presents with a lot of the symptoms that I had talked about that Jane presented with. Fever, sweats, chills, headaches, body aches, nausea, vomiting, a general malaise, an enlarged spleen, mild jaundice, more rapid breathing, and liver enlargement. So those are just typical symptoms of uncomplicated malaria, which is definitely something that needs to be treated, but it's not nearly as fatal as severe malaria. So if somebody had organ failure or blood metabolism abnormalities, then they could develop severe malaria. So that comes with symptoms such as cerebral malaria, which is it comes with a realm of neuro disabilities. So that could include abnormal behavior, impairment of consciousness, seizures, stuff like comas, and other neurological abnormalities. Also, it can present with severe anemia, hemoglobinuria. So both of those are a result of hemolysis, which is a destruction of your red blood cells. It presents with blood coagulation abnormalities, acute respiratory distress syndrome, which is an inflammatory reaction in the lungs, which prevents oxygen exchange. And it can happen even after the parasite counts have gone down in response to the treatment. Next is acute kidney injury, low blood pressure. The low blood pressure is caused by cardiovascular collapse, hyperparasitemia, and metabolic acidosis is excessive fluidity in the blood tissue and fluids, and it's often associated with hypoglycemia. And that is the next symptom, which is hypoglycemia, which means low blood glucose, which can also occur in pregnant women with uncomplicated malaria. So that's just something to know about the presentation of symptoms. Treatment. So there's a lot on the treatment of malaria. It should be performed immediately. And the drug regimen really just depends on a variety of factors and the specifics of each case, including the clinical status of a patient, the species of malaria that's causing the infection, where a patient obtained the infection, if the patient is pregnant, if they have any drug allergies, and so on. So this picture on the slide to the left is actually an example of a flowchart or algorithm for the diagnosis and treatment of malaria in the US that doctors can use to assess treatment strategies and make an informed decision on what they want to do for their patient. I'm not really going to go into that. If you want to be a physician, I think that's something that you could look into, and you'll definitely learn eventually. But yeah, that was my presentation on malaria. This is my works cited. I got most of my information from the CDC, but also from the World Health Organization, MSU, and other websites as well. Thank you.